NIH funding cuts hurt basic research in patients by Dan Wilson from the September-October 2025 issue of Skeptical Inquirer. Breakthroughs in medicine that transform patients' lives for the better depend on adequately funding basic research, the kind of research that aims to understand how things work. This funding is provided largely by the National Institutes of Health, NIH, with other global funding sources for health research not even coming close. As of this writing, the current administration proposes a 44% cut to NIH funding in the 2026 fiscal year. If these cuts happen and continue in following years, they will both slow scientific progress and directly hurt patients. Millions of people suffer from illnesses that are poorly understood. Answering fundamental questions about how our cells and the biological world around us work gets us closer to treating and even curing these diseases. Oftentimes, the connection between basic discoveries and practical cures is not readily apparent to most people and is not spotlighted well in traditional media sources. Take, for example, a baby at the Children's Hospital of Philadelphia who was, so far as we can tell, recently cured of a rare genetic disease using personalized CRISPR technology. Normally, patients with this disease, CSP1 deficiency, need constant curation of their diet and usually end up needing a liver transplant. Now, thanks to technology capable of correcting errors in a living person's DNA, this baby will not have to suffer and will likely live a long life. What field of study do we have to credit for making the discovery and eventual use of CRISPR technology in this way possible? The study of how bacteria defend themselves against viruses. Sounds like a pretty unassuming venture, right? Yet it is this kind of exploratory work that leads to breakthroughs in unpredictable ways, and this work was funded largely by the NIH. Cutting the NIH's ability to fund biomedical research, done by scientists exploring questions that few others even know are being asked, means that we will see less of this in the future. This recent example is a historical first, where a baby's DNA was changed to treat a genetic disease after being born. This opens possibilities of addressing other genetic disorders in the same way. Diseases such as cystic fibrosis, progeria, Huntington's disease, type 1 diabetes, and many more could be next. But the work needs to continue and be supported financially. I recognize, however, that even this example may not hit close to home for most people. Most people do not have genetic diseases, and people will often be more willing to fund issues that they are more likely to see in themselves or their families. While this breakthrough is historic and has given invaluable new life to a baby, convincing people that science funding is important means telling stories like this that can apply more to the average person. So what if I told you that work funded by the NIH has led to a cancer cure? A cure for a type of cancer, that is. That cancer is chronic myelogenous leukemia, CML, and that cure is a targeted therapy called imatinib, brand name Gleevec. In 1996, physician-scientist Dr. Brian Drucker and his team published preclinical results showing that their small molecule inhibitor could stop CML cancer cells in their tracks. This work, funded by the NIH, would be the start of a revolutionary new approach to cancer treatments and save thousands of lives from an otherwise bleak and painful disease. The work funded efforts to understand the structure and function of the unique mutated enzyme that is the culprit of most CML cases. Researchers realized they might be able to design a drug that specifically targets this mutated enzyme while leaving normal ones alone. It ended up working better than anyone expected. In the years leading up to this publication, Drucker had experienced heartbreaking stories that would be familiar to anyone who has closely dealt with a loved one dying of cancer. From painful bone biopsies resulting in less than hopeful news, to watching helplessly as lives full of potential were cut short. Drucker, like most doctors, wanted desperately to be able to offer something better to his patients. For these patients, that came in the form of those preclinical results of Gleevec, progressing to show outstanding success in clinical trials. How much success? Well, before Gleevec, the average CML patient could expect to die within 2 to 3 years of their diagnosis. With Gleevec, the average CML patient can be expected to live a normal lifespan. A normal lifespan after a cancer diagnosis is effectively a cure. And we have NIH-funded work done by brilliant and motivated scientists to thank. Shouldn't our leaders want more of this? While Gleevec is one of my personal favorite science success stories, the stories don't stop there. Over the past 60 years or so, breast cancer survival rates have tripled thanks to focused funding efforts by the NIH and other institutions that have strengthened our understanding of how best to detect and treat breast cancer. 5-year survival rates for men with local and regional prostate cancer are up from 69% in the 1970s to 100% today. About 80% of children with cancer today go on to live full lives. This is because we cared enough about these issues to fund the efforts of the scientists and doctors trying to find solutions. The NIH is by far the largest funding source for biomedical research in the world, which has made the United States a leader in medical research for decades. By proposing sweeping cuts, we are essentially saying that we do not care as much about disease, be it chronic, infectious, or genetic. If we choose not to invest in the basic research necessary to achieve life-changing breakthroughs, then the breakthroughs will slow and may even stop. At least, they won't come from the United States anymore. And it will take time for other nations to build comparable biomedical research infrastructures. The inevitable result of all this is that more patients will suffer in ways that we could have prevented. If suffering can be prevented, we ought to do so to the best of our ability. What greater goal can science serve? Thank you for listening to Skeptical Inquirer Audio Edition. This podcast is produced by the Center for Inquiry at our headquarters in Amherst, New York. If you would like to support our work, please consider subscribing to Skeptical Inquirer magazine at skepticalinquirer.org. It is listeners like you that make our work possible. With your support, we can continue to promote science, reason, and secular values throughout the world. Thank you.